Your immune system is attacking you right now. Not because something went wrong, because something got stuck. Most people think inflammation means a swollen ankle or a sore throat. They're not wrong, but that's only half the story. The half no one talks about is the kind you can't feel, the kind that runs silently for years, the kind that shows up later as heart disease, diabetes, Alzheimer's, and cancer. What is it actually doing inside your organs? Why does your own immune system turn against you? And what does the anatomy tell us that most health advice completely ignores? Chronic inflammation is now linked to 7 of the 10 leading causes of death in the United States. Not associated, linked, as a direct mechanism. Here's what's actually happening. Inflammation starts as a solution. Your immune system detects a threat, a bacteria, a virus, a torn muscle fiber, a splinter. It sends in the response team. White blood cells flood the area. Blood vessels dilate. Fluid rushes in. That's the redness, the swelling, the heat you can see and feel. It works. The threat gets neutralized. The response team leaves. The tissue heals. That process takes days, sometimes a week. Then it stops. Chronic inflammation doesn't stop. The trigger never fully goes away, or the immune system never gets the signal to stand down, or both. And so the response team stays. White blood cells keep releasing their chemical signals, called cytokines, into surrounding tissue, day after day, month after month, sometimes for decades. The tissue wasn't designed for that. Let's start with your arteries. When chronic inflammation reaches the walls of your coronary arteries, white blood cells begin moving into the arterial wall itself. They accumulate. They oxidize LDL cholesterol trapped inside. They form what pathologists call foam cells. Those foam cells cluster into fatty plaques. The plaques narrow the artery. They harden it. And the most dangerous ones don't block blood flow gradually. They rupture suddenly. That rupture triggers a clot. The clot blocks the artery completely. That's a heart attack. Atherosclerosis isn't a plumbing problem. It's an inflammatory disease. This was confirmed in a landmark 2017 clinical trial called CANTOS. Researchers gave heart attack survivors a drug that specifically targets one inflammatory cytokine, interleukin-1 beta, without touching cholesterol at all. Patients who responded to the drug had a 15% lower risk of another heart attack, not because their cholesterol changed, because their inflammation went down. Now move to your brain. Chronic neuroinflammation activates cells called microglia. Microglia are the immune cells of the brain. Under normal conditions, they're maintenance workers, clearing debris, supporting neurons, monitoring for threats. Under chronic inflammatory conditions, they stay activated. They release cytokines that damage surrounding neurons. They impair the synaptic connections between cells. And in long-term studies, elevated inflammatory markers in midlife are associated with significantly higher rates of cognitive decline and Alzheimer's disease decades later. Your brain is not protected from your immune system. It just has its own version of it. Now move to your pancreas. Chronic, low-grade inflammation interferes with insulin signaling at the cellular level. The mechanism involves a cytokine called TNF-alpha, which directly impairs the ability of cells to respond to insulin. Muscles, fat tissue, and the liver all become less sensitive. The pancreas compensates by producing more insulin. Eventually, it can't keep up. Blood sugar rises. Type 2 diabetes follows. Inflammation doesn't just correlate with type 2 diabetes. In many cases, it precedes it by years. Here's what makes this worse. The triggers for chronic inflammation are things most people do every day. Visceral fat, the fat that accumulates around your organs, not under your skin, is metabolically active. It secretes cytokines directly into your bloodstream, continuously. The more visceral fat you carry, the higher your baseline inflammatory state. Chronically poor sleep elevates interleukin-6 and TNF-alpha within days, not weeks, days. A diet high in refined carbohydrates and industrial seed oils drives oxidative stress that feeds the inflammatory cycle. And chronic psychological stress elevates cortisol, which initially suppresses inflammation, but with prolonged exposure, the immune system becomes resistant to cortisol's signal, and inflammation rises. These aren't separate risk factors. They feed each other. Visceral fat disrupts sleep. Poor sleep increases appetite for refined carbohydrates. Refined carbohydrates add visceral fat. Stress makes all of it worse. The cycle is self-reinforcing once it starts. Can you measure it? Yes. The most commonly used clinical marker is high-sensitivity C-reactive protein, or HSCRP. CRP is a protein your liver releases in response to inflammatory signals. Values below 1 milligram per liter are considered low risk, between 1 and 3, moderate, above 3, high. It's not a perfect marker. It rises with acute infections and can miss certain chronic patterns, but it's the most accessible proxy we currently have, and it's on most standard blood panels if you ask for it. There's no drug that fixes chronic inflammation by itself. The interventions with the strongest evidence are not pharmaceutical. Sustained aerobic exercise reduces circulating cytokines and improves insulin sensitivity within weeks. Sleep of 7 to 9 hours per night directly lowers inflammatory markers. A diet built around whole foods, fiber, and omega-3 fatty acids shifts the inflammatory balance at the cellular level. And visceral fat loss, through any sustainable means, reduces the single largest driver of baseline inflammation in most adults. None of this is surprising, but the anatomy makes it concrete. Inflammation isn't a vague wellness concept. It's a specific molecular process happening in specific tissues. And when it doesn't resolve, it doesn't just sit there. It slowly remodels the organs it touches: your arteries, your brain, your pancreas, your liver. The question isn't whether chronic inflammation is affecting your body. At low levels, in most adults living modern lifestyles, it almost certainly is. The question is how much, and whether you're making it better or worse every day. That answer is in your blood, and mostly, it's in your habits.